Namaste and welcome back to Golden Drops and Healing Breath. So far, we have explored Swarnaprashan, the golden nourishment, and Nasya, the healing breath to brain. But Ayurveda rarely works in isolation. Its true strength lies in combination, balance, and synergy. Today, we bring both therapies together to understand how Swarnaprashan and Nasya act as powerful combined approach in pediatric neurological care. The Ayurvedic principle of combination. Ayurveda believes that when therapies are combined correctly, their effect is amplified. Yogat bhavati shreshtvam, that through proper combination, therapies become more effective. This is the foundation of using Swarnaprashan and Nasya together. How Swarnaprashan works. Swarnaprashan acts internally, given as Lehan Karma. It nourishes Medha, Bala, Ojas. Medha Agni Bala Vardhanam, enhancing intellect, metabolism, and strength. It builds the foundation of a child's neurological health. How Nasya works. Nasya works externally yet directly. Through the nasal route, it reaches the brain and sensory organs. Nasa hi shiraso dwaram. The nose is the gateway to the brain. Nasya clears channels, enhances perception, and stimulates neural pathways. The synergy, insight plus direct action. When combined, these therapies create a dual action model. Swarnaprashan nourishes from within and Nasya that acts directly on the brain. One builds, the other activates. One strengthens, the other clears and guides. Bhaya abhyantara sanyogat sampurna chikitsa bhave, that when internal and external therapies combine, treatment becomes complete. This is the essence of Ayurvedic synergy. Evidence and modern correlation. Classical texts emphasize both Rasayana and Nasya for mental health. Modern understanding supports this. Swarnaprashan, that supports neuroprotection, cognition, immunity, and Nasya that delivers drugs via olfactory pathways influencing brain centers. Together, they resemble a systemic plus targeted neurotherapy approach. Let's understand this through example. Suppose there's a child that struggles to form words. Swarnaprashan supports memory and intellect, while Nasya stimulates speech centers and sensory response. Now, let's take an example of ADHD. That Swarnaprashan builds stability and immunity, and Nasya calms the mind and improves attention pathways. Now, if you take example of ASD, the autism, Swarnaprashan nourishes cognitive potential, Nasya improves sensory integration and responsiveness. And lastly, we will take the example of epilepsy. That Swarnaprashan strengthens nervous tissue and Nasya helps regulate neural excitability. So these were the illustrative scenarios, but they reflect how integration works in practice. So in application, Swarnaprashan as Lehan Karma daily for 6 months in neurodisorders and monthly on Pushya Nakshatra in healthy children. And Nasya gentle, age appropriate, supervised using oils like Brahmigrit or Anutel. Together they create a structured holistic protocol. Yukti Vipashyam Shreshtam, that rational, well-planned therapy is the best treatment. And this is what this combination represents. Not random use, but planned, intelligent integration. In the next episode, we will move into a practical guide for parents and practitioners, the dosage, precautions, and real-world applications. Until then, remember that true healing is not in one therapy, but in the harmony of many. Thank you.